Welcome to Fun Facts Online. Today, we're tackling a subject that is anything but fun, but is critically important to understand. Imagine a single grain of salt. That's all it takes. A quantity of fentanyl so small it could rest on your fingertip can be a lethal dose. This is the stark reality of a synthetic opioid that has brutally redrawn the map of the global drug trade and unleashed a public health crisis of unprecedented scale. What started as a breakthrough in medical pain management has become a harbinger of addiction and death in a complex saga of chemistry, commerce, and human tragedy. Initially developed in 1959 by Dr. Paul Janssen, fentanyl was a medical marvel, about 100 times more potent than morphine and 50 times more potent than heroin. It offered profound relief for patients with severe pain. Its journey from a strictly controlled medical tool to a street drug has been a gradual but devastating one, culminating in a crisis that has overwhelmed communities and left a trail of shattered lives. This isn't just a story of addiction, it's a story of globalization, sophisticated criminal networks, and a collective failure to grasp the scale of the threat. Fentanyl's immense power lies in its chemical structure. As a synthetic opioid, it is created entirely in a laboratory. It doesn't need poppy fields like heroin. It just needs precursor chemicals and a chemist. Fentanyl works by binding to the body's opioid receptors, which are found in areas of the brain that control pain and emotions. This action unleashes a surge of dopamine, creating intense feelings of euphoria and relaxation. But this potent effect is exactly what makes it so deadly. Like other opioids, fentanyl affects the parts of the brain that control breathing. During an overdose, breathing can slow to a dangerously low level or stop altogether. Shockingly, research has shown that fentanyl can begin to impair breathing about 4 minutes before any change in alertness, and at concentrations 700 times lower than those that cause sedation. This explains why so many overdoses are fatal before the individual even realizes what is happening. The clandestine nature of illicit drug production means there is zero quality control. Just 2 milligrams of fentanyl, the equivalent of a few grains of salt, can be a lethal dose. To put that in perspective, analysis by the U.S. Drug Enforcement Administration, or DEA, of seized counterfeit pills has found that 42% contain at least that deadly 2 milligram dose. The ease with which fentanyl's chemical structure can be modified has also led to the proliferation of an ever-expanding family of fentanyl analogs. These are designer drugs with similar chemical structures that often mimic, or even amplify, the effects of the original. Some are terrifyingly potent. For example, carfentanil, an analog used to tranquilize large animals like elephants, is estimated to be 10,000 times more potent than morphine. Other analogs like alfentanil, sufentanil, and lofentanil have also appeared on the illicit market, creating a constant challenge for law enforcement and public health officials who are in a perpetual race to identify and control these new and deadly substances. This incredible chemical potency, combined with the relative ease of production, has created the perfect storm for a globalized trade in death. The fentanyl supply chain is a chilling example of the dark side of globalization, a complex and adaptable network spanning continents, exploiting legitimate industries, and leveraging technology to move its deadly product. For a long time, the primary source of the precursor chemicals needed to make illicit fentanyl was China. The country's vast and loosely regulated chemical and pharmaceutical industries provided fertile ground for vendors to produce and export these essential building blocks. Initially, China was a direct source of finished fentanyl, often shipped through the mail in packages mislabeled as dog food or motor oil to evade customs. Following intense international pressure, China placed fentanyl and its analogs under class-wide control in 2019. This was a significant step, but it didn't sever the supply chain. Instead, the criminal business model simply adapted. Traffickers shifted from sourcing finished fentanyl to acquiring the precursor chemicals instead. The United Nations has placed key fentanyl precursors under international control, but clandestine chemists continue to find ways around these controls by using alternative, non-scheduled precursors, or by slightly modifying the synthesis process. With this shift, Mexico emerged as the primary production and trafficking hub for fentanyl destined for the United States. Powerful transnational criminal organizations like the Sinaloa and Jalisco New Generation cartels integrated fentanyl production into their existing drug trafficking infrastructure. They source precursor chemicals from China and other countries, sometimes diverting them from legitimate industrial supply chains. These precursors are then transported to clandestine labs in Mexico. There, they are synthesized into fentanyl powder, which is then often pressed into counterfeit pills. These pills are made to look like legitimate prescription opioids, such as oxycodone, often called M30s, as well as other drugs like Xanax or Adderall. These fake pills are then smuggled across the US-Mexico border, concealed in vehicles, cargo shipments, or by individuals. The sheer volume of traffic and the tiny amounts of fentanyl needed to produce millions of doses make stopping it at the border a monumental challenge. The internet has become a crucial facilitator for this deadly trade. The dark web provides a cloak of anonymity for traffickers and buyers, where fentanyl can be sold with relative ease using cryptocurrencies like Bitcoin to obscure the financial trail. More recently, the trade has spilled onto the open internet and social media. Traffickers now use platforms like Facebook, Instagram, Snapchat, and TikTok to advertise their products, often using emojis and code words to evade detection. These platforms have become a one-stop shop, allowing for the marketing, sale, and arrangement of delivery directly to consumers, including teenagers and young adults. Encrypted messaging apps like WhatsApp and Telegram provide a secure channel for finalizing these lethal transactions. The illicit fentanyl trade generates enormous profits, which are then laundered through sophisticated schemes. Traffickers use everything from bulk cash smuggling in shell companies to complex trade-based laundering and the increasing use of cryptocurrencies to hide their profits from the authorities. The consequences of this global trade are nothing short of catastrophic. The most immediate and devastating impact is the staggering number of overdose deaths. In the United States, fentanyl is now the leading cause of death for people aged 18 to 45. In 2022 alone, there were over 7,800 unintentional overdose deaths involving fentanyl in the U.S., a 31-fold increase from a decade before. The CDC estimates that well over 100,000 people died from drug overdoses in a single recent year, with fentanyl being the primary driver. This crisis is not confined to North America. There are growing concerns about the spread of fentanyl in Europe, Asia, and Australia. While the numbers are currently lower, an increase in deaths linked to synthetic opioids has been noted in Europe since 2017. A major fear is the contamination of other illicit drugs, like cocaine and methamphetamine, with fentanyl. This could lead to a spike in overdose deaths among people who do not normally use opioids and therefore have no tolerance for their powerful effects. Behind these staggering statistics are countless personal stories of heartbreak and loss. Families have been torn apart. Parents have had to bury their children, and children have been left to grow up without their parents. Many people who become addicted to fentanyl started with prescription opioids for legitimate pain, only to find themselves trapped in a cycle of dependence that leads them to the illicit market. Recovery is a long and arduous journey, but the stories of those who have survived offer a glimmer of hope, highlighting the importance of access to treatment and community support. The fentanyl crisis has a profound ripple effect across society. Healthcare systems are overwhelmed, with emergency rooms seeing a constant stream of overdose patients. First responders, police officers, firefighters, and paramedics are on the front lines, often risking their own safety and facing immense emotional tolls as they are repeatedly confronted with these tragedies. Social services are also under immense strain. The opioid crisis has led to an increase in the number of children entering the foster care system as their parents struggle with addiction or die from an overdose. The economic consequences are also significant. from the loss of productivity to the massive costs of healthcare and law enforcement. The global nature of this trade requires a multifaceted and coordinated response. Law enforcement agencies are in a constant battle to disrupt the flow of fentanyl and its precursors. International cooperation, particularly between the US, Mexico, and China, is crucial. However, interdiction efforts alone are not enough. The adaptability of criminal networks means that as long as there is demand, traffickers will find a way to supply it. This is why there is a growing recognition that a public health approach is essential. This approach focuses on reducing the harm associated with drug use and providing support to those struggling with addiction. A key pillar of this response is harm reduction. These strategies aim to reduce the negative consequences of drug use without necessarily requiring abstinence. One of the most important is the wide distribution of naloxone, a life-saving medication that can reverse the effects of an opioid overdose. Getting naloxone into the hands of first responders, community members, and people who use drugs is critical for overdose prevention. Another tool is fentanyl test strips. These strips allow people to test their drug supply for the presence of fentanyl, helping them make more informed decisions to reduce their risk of overdose. Other harm reduction strategies include syringe service programs, which provide clean supplies to prevent the spread of diseases like HIV, and supervised consumption sites, which are facilities where people can use drugs under the supervision of trained staff who can intervene in an overdose. Alongside harm reduction, expanding access to evidence-based treatment for opioid use disorder is crucial. This includes medication-assisted treatment, or MAT, which combines medications like buprenorphine or methadone with counseling and behavioral therapies. The global synthetic drug trade, with fentanyl at its epicenter, is a complex crisis with no easy answers. It was born from a deadly intersection of chemistry, commerce, and human vulnerability. The future of this crisis will depend on our ability to adapt and respond on multiple fronts. We must continue to innovate in law enforcement while recognizing the limitations of a purely supply-side approach. We must embrace and expand public health strategies that prioritize saving lives. We must foster global cooperation to disrupt the transnational criminal networks that profit from this deadly trade. And most importantly, we must never lose sight of the human cost of this epidemic. Every overdose statistic represents a life lost, a family shattered, and a community in pain. The fight against fentanyl is a fight for our collective future. It will require a sustained and coordinated effort from all sectors of society. The path forward is long and difficult, but with a commitment to evidence-based policies, compassion, and a belief in the power of human resilience, it is a fight that we can and must win.